when the world has got you down. And
Alzheimer's sucks. It's an equal opportunity disease that chips away at everything we hold dear. And to date, there's no cure. So until there is, we continue to fight with the most powerful tool in our arsenal, love. This is Love Conquers Alls, a real and really positive podcast that takes a deep dive into everything Alzheimer's, the good, the bad, and everything in between. And now, here are your hosts, Susie Singer-Carter and me, Don Priess.
Hello, everybody. It's Susie Singer-Carter. Happy 2023.
Yes, and I'm Don Priess, and this is the first show of 2023, Love Conquers Alls. And hi, Susan.
Donald, Happy New Year.
Yes. Happy New Year. Let's hope it's a Happy New Year, please. Please.
Yes.
I'm tired of the shenanigans.
Like my girlfriend says, like that.
She does. So classy.
It's so classy, but I will
Indeed.
step over cracks and I will knock a lot of wood because last year was harrowing.
Yeah, it was something. It was kind of hopefully it was like the culmination of the 3 years of whatever we've been in, the quagmire we've been in, and it really just came to a head last year. And we hope that we're now heading, to the other side of the hill
To some semblance of normalcy. Right?
Yes. Wouldn't that be lovely? Wouldn't that be awesome?
I don't remember what it is, though.
I know. I wouldn't recognize if it hit me in the face. That's right. That's how we used to live.
We're like battered people. We're like, oh my God, like it's sunny today. Our bar is so low. Yeah, we're like twitching.
Oh, gosh. Well, we got to
Honestly,
laugh about it, I guess.
we really are. But maybe it's good because maybe it recalibrated us to sort of appreciate the smaller things. And, I think that's exactly a good thing.
That's exactly right. I mean, I do appreciate, like, if you do anything of that used to be considered normal, now I do appreciate it a lot more. Mm-hmm. And
yeah,
boy, but
like we were in a restaurant last night for my girlfriend's birthday, and it was so nice to be in a restaurant, and it was really crowded and noisy. And normally you'd be like, God, it's so noisy. Why is this the worst?
Bring on the noise.
It's like, I love it. It's noise. It's people.
It's life.
It's life. It's so nice. It's not takeout.
Exactly. Curbside pickup.
Curbside pickup. Woohoo. Anyway, that's enough of that crap.
Yes.
All right.
Absolutely.
Well, anything else good? What's happening with you? How's everything?
Working on a documentary that we hope to have done very soon, so we can roll right into the next documentary, which is ours. No Country for Old People. I feel very good about it, and I appreciate everybody that's been supporting us, the National Consumer Voice for Quality Long-Term Care, and Canner here in California, and AMWA, the AAJ. Look at me with all my acronyms. So many letters.
I'm like professional, but I'm not as professional as our guest. Why don't you tell everyone who we have?
I don't know if anyone is as professional as our guest, who happens to be Mary S. Daniel. Mary is a board-certified patient advocate with more than 30 years of medical practice management experience. During COVID, in order to see her husband, Steve, an Alzheimer's patient, she took a job as a dishwasher in the Memory Care Center where he lived. Her story of perseverance and determination was featured in hundreds of news outlets around the globe. Mary founded the Facebook group Caregivers for Compromise Because Isolation Kills Too, which has over 14,000 members and chapters in every state. Fighting for the rights of her husband and thousands of others who were isolated, her grassroots efforts got the governor's attention, and Mary was named to the Florida Task Force on the safe and limited reopening of long-term care facilities. The recommendations of the task force were accepted, and essential caregivers were allowed back in facilities to see their loved ones. She's a remarkable woman with a remarkable story, and we can't wait to hear more, so let's say hello to Mary Daniel. Hello, Mary.
Hello
Hi,
there.
Mary.
I'm thrilled to be here with you guys.
Hi, Mary. Thank you for coming. Well, first, before we get in, I just want to say that 3 weeks ago, you lost Steve.
I did.
And my heart is with you. And I know the road you've been. A lot of us, we all walk, we've all got that road. It's a different street, but it's the same road. So we get
Correct.
it. And I know all the mixed feelings you're feeling now, and I know it's a huge transition for you.
It is. He was diagnosed 9.5 years ago. So I have been his caregiver for that amount of time. A daily responsibility for that amount of time. And his parents before him. His father just died 2 years ago. And so I was their sole caregiver, literally for decades. We were married 26 years. And so it's a real, I knew what the end looked like. In the sense of, I knew at one point that this was going to end. I've known that, right, for a very long time. But the realization that we're actually here and that it's over is a real interesting place to be in trying to figure out sort of my new normal, I guess.
Totally. Well, before you got to this new normal, can you just inspire us with how you came up with this idea to go, and get a job, and how that worked out, and what obstacles did you hit, or didn't? Just give us a little bit, because I think it's just extraordinary.
Back in March of 2020, when we got word that we were locked out, that we were not going to be able to go back in, I immediately called the corporate office of our facility, and I said, very naively, this isn't going to work for me. I've got to go see him. I promised him that I would be with him every single day. And so I have to be in there and I have to see him. And they said, like all the rest of us, we've got 10 days to slow the curve or whatever it was back then. Let's be patient. Let's see what happens. And that's when I asked for the job. Let me go in and work. Let me do something in there. And they said, let's just see what happens. This is going to be over in a couple weeks. And the days turned to weeks and the weeks turned to months. And before I knew it, we'd had a couple months go by, and we tried 2 window visits. He cried the entire time. It was just awful. He couldn't understand what was happening. Till the very end, he never knew what COVID was. He never understood that I was ever a dishwasher. He had no idea about any of that. So I knew that I had to fight to get to him. And so I started emailing and calling everybody that I could possibly think of, from every reporter. I'm in Jacksonville, Florida, from local reporters here. I would copy the governor's office and the head of the healthcare administration here. I just started shooting out these emails and making phone calls saying, my mantra at that point was, there has to be a better way. Let's do a clean room where we can go in, and then after I leave with Steve, you scrub it down and you bring in the next family member. I'll wear a hazmat suit. Whatever you want me to do, I'll do it. There just has to be a better way. This is not going to work. I started making some noise, and it eventually got the attention of the corporate office again. I was on the news quite a bit. I had a couple reporters pick up the story in Jacksonville, and the facility called me out of the blue at the end of June of 2020 and said, we have a job if you want it. And I said, I'll take it, without knowing exactly what I was getting myself into. And I said, what is it? And they said, it's a dishwasher. So dishwashing it was. So I started on July the 3rd, went in for my first shift. And after 5 hours, I worked 5 hours that day doing lunch and dinner dishes. I got to go in and see Steve for the first time after 114 days.
Ugh.
Wow. Was there any pushback initially for them? Are you even seeing him once you were in there? Because
No.
you're coming from the outside. You're coming from outside. You're not staying there.
They told me on that first phone call that that after my shifts, I would be able to go and see him and stay with him as long as I wanted to. That was on that very first initial phone call. I will tell you that I was so cautious. My brother-in-law is a physician here in Jacksonville. I went to his office before every single shift. They did not require me to do it, but I took a COVID test before every single shift. I knew, with the attention the story was getting, if I was the person that brought COVID in, this was not going to go well.
No,
right? So I was very, very cautious.
Yeah.
A lot of pressure to be sure that I was absolutely, that I was being careful, that I was not going out and being careless and doing things that I didn't need to be doing, to bring it into the facility. So So they let me in, and once that job started, the local reporter here did a story on me being in, and that story went viral.
Right. And so before you got the job in July, so what kind of pushback were you getting before that happened? I know you said you ended up going to reporters and to the news stations and getting, and causing some noise. So, but during that time you were getting pushback, you weren't getting any cooperation, right?
I think everybody was so focused on the COVID that they were losing sight. They had no thoughts about what the isolation was doing.
Right.
And that's why the group, when the story went viral, I started the Facebook group, Caregivers for Compromise, because isolation kills too.
Right.
With the real message that we understood the lockdowns were done for the best of intentions. There's no question in my mind about that. It's what we thought we needed to do, but we really didn't give any thought to the fact that isolation kills too. That we ended up seeing, thousands of death certificates with the cause of death as failure to thrive.
Sure.
Because people gave up. They weren't seeing the people that they loved. Many of them thought that they were being punished. What have I done? Does my daughter not love me anymore? All of these things that you're not able to explain to a dementia patient, particularly for them to understand what was going on. And so it was incredibly painful to have to watch this through a window. So many people had to watch their family members die through a window. That our message was the isolation kills too. And that was the part of the story that we wanted to tell. And thankfully, it got the attention of Governor DeSantis' office.
And do you think it was because of the news that is the thing that pushed it over?
There's no question about that.
No question
There's no
about
question. Because, I've been writing him for months,
Right.
And you know how that is, never getting any sort of answer back from anybody. But he was at a news conference and he mentioned a woman in Jacksonville who took a job as a dishwasher. Okay, so I'm on his radar.
Gotcha.
So now I know I'm on his radar. The next news conference, a few days later, he mentioned my name. He mentioned me by name.
Right.
Okay, we're getting there.
Now you're getting there. Now you're cooking.
Right.
Okay.
Exactly. And then I got a call from his office saying he was going to be in Jacksonville and wanted to meet with me. I had no idea anything about the task force, but we did. I sat down and met with he and his wife. And as soon as that meeting was over, we went into another room where there was a press conference and he announced the establishment of the task force and that I would be a member of that task force.
Love it. I love it. So I'm laughing a little bit because I think the fact that they chose dishwasher for you, which was actually a gift because that is.
I don't think they thought I would take it.
Exactly.
Right.
So, but the fact that you did, and it was dishwasher, and so that in turn really helped you because it gave you the kind of publicity that love will out, and that
There's
if it's
no
dishwashing,
question.
right?
If I had been the activities director, or the receptionist, a part-time receptionist, it wouldn't have made any difference whatsoever. It's funny, I actually wrote a letter, an email a couple days ago to the CEO of ALG Senior, is the corporate office where my husband was, to thank him. I mean, none of this, the changes that we've been able to make and being with Steve, and so many, tens of thousands of other people who got to be with their loved ones as well. I mean, none of it would have happened if they hadn't offered me the job. I mean, none of it would have happened,
Right.
And
Because
so
the story wouldn't have been out there, and
Correct.
You wouldn't have been on any radar. It would have, you would have been
Well,
just
it was
one
nice
of
of you to thank them
the
because-
frustrated.
But it was nice of you to thank them because I don't think that they thought it, like you said, it was going to go that way. But it was classy of you to do that.
Well, when we first started, my very first day, they called me in and said, we're going to have a conference call with the corporate office that's in North Carolina. And I said, okay. And they said, we want to be sure you understand on page 47 of the manual that I hadn't received yet, my employee manual, it says you can't speak to the media. And I'm thinking to myself, okay, I see what we're doing here. I see how this is going to work. And they said, we have a PR guy that you're going to have to work with and he'll arrange everything for you. And I said, well, I'm going to need to get his number because I've got a reporter who's meeting me outside when my shift is over, right, today. So it turns out he is an amazing guy. He and I hit it off wonderfully. We have become wonderful friends. He saw the story for what it was, as a great, not only a good, heartwarming story, but also good for the company. Let's use this to be good for the company. And that's what I've told him all along.
Smart.
You guys are a part of this, and we need to use that this is the type of company, for whatever reason. Once it started rolling, they were right there with me. James Harvey was the PR guy, and he and I back to back interviews, had him arranged, had him, organized. We were really working together to really make the most of this and to get the most out of it. So it turned out to be a pretty cool experience.
That's great. That's good. It was a happy accident, probably,
Correct.
at the end of the day, right?
Exactly.
Yeah. Not to keep, and I don't mean to be negative, but I just want to keep pulling it back to like how much, serendipity also went into it, and sort of good fate for you that all of this, like it all worked just right. And that's what you hope for when you're advocating and when you're trying to make some change, is that you don't know how it's going to happen. You just got to get out there and activate it. And whatever,
exactly
you can't predict. And I just wanted to highlight that because, you had no idea that they were going to offer you that. And that was the best thing they could have offered you. Right. And they obviously didn't predict it. But then it's like, hey, we all won from doing this.
Right. Exactly.
And so that's hoping and I keep bringing it back to a bigger reform that we need, which is... We're dire, we really do need that. And that's the whole thing, is that, just look at this lady, what she's done, this lovely lady, that, we all can do that. It takes love. That was your motivation at the beginning. 100%. And 100%. And so love conquers alls, right? I mean, it's true. And ingenuity and resilience.
I had no idea what it was going to look like. I just knew, after sitting still for a couple months, I knew this wasn't getting me anywhere. And so I just felt like it, that if nothing else, if nothing worked, even if I didn't have any success, I wasn't just going to sit back and wait for it to happen to me. I was at least going to be able to say I did my best to try to get to him. And that's what I was shooting for at first. I'm not going to just sit here and let them tell me what it is we're going to do and not do. Somebody has to see what this looks like. These people need to see what this looks like so that they can be sure that they understand the harm that's being done to these tens of thousands of people that have just been basically locked away.
Right,
and with loved ones who want to get to them. And you have people, and not everybody else knew what to do, but the beauty of the Caregivers for Compromise group is they all got to follow in behind me, and we started educating people on what they could do in their own states, providing them. I mean, I said it 1,000 times, educate yourself so that you can educate them. And them was the administration of the facilities, your politicians in your area, your legislators who are deciding what's happening here. We need to educate them so that they understand exactly what this looks like up close and personal.
Absolutely.
Do you think there has been or will be any residual effect on isolation, because this was COVID was a very specific thing? But in the future, I mean, you can see it when you walk into some of that some of the residents are isolated. They stay in their rooms, everything. Did you see any type of shift for conquering isolation in the future, or do you think it's just going to kind of go back to where it was?
Well, we are currently working on a federal bill to be sure that it never goes back to the way it is. There's going to be something else down the road. There's going to be, even a flu outbreak. It could be a flu outbreak. It doesn't, it doesn't have to be a COVID type incident. We had somebody, a facility here in Florida that shut down over Thanksgiving, not this year, but last year, over a scabies outbreak.
I was going to say something like that. Yeah.
Correct. So that now they know they have the power to do it. And so before, they've never done it before. They'd never actually slammed the doors closed before. Now they know they have the power to do it, and so they're doing it. They're continuing to do it. So that's why we're continuing. We are far from being done. We are working on a federal bill. It will be reintroduced in a matter of weeks into the new session of Congress. We have 80 co-sponsors already, and we anticipate that in this session, we can get it passed in this session. So we're working to be sure. And it's basically similar to the law of Florida. An essential caregiver, 2 essential caregivers will always be allowed to go in following the same safety protocols as staff. That's all we ask. We'll do whatever the staff is required
Fabulous.
to do.
Yeah.
That's awesome. And so, I mean, I don't know, because I haven't done my research yet on this in terms of the different states and how they have responded to this movement. I know that nothing changed, at least in California, that I'm aware of. They listened to the CDC. I think the first time I saw my mom was like a year, like 13 months before I actually saw her in person. And it was 10 feet apart, outside with masks.
Outside, yeah.
And I went to my car crying because it was so
worse.
frustrating.
It was almost
worse.
Right. How do you say I can't touch them? I mean, how do you say that I'm not allowed to touch them? And in fact, for me, on the task force, that was a real area of that I fought very hard for. The Surgeon General of Florida was going to let us back in, but not let us touch. And I mean, I sat right here at this desk one day, and I mean, in the middle of a meeting, and slammed my fist on the table, and I said, "That's a deal breaker for me. We have to be able to touch. I have to be able to hold his hand. I have to be able to rub his back. For him, for Alzheimer's, for dementia patients, that human touch.
That's communication. That is
it.
it.
That's how he feels my love, is me holding
That's
his
right.
hand and rubbing his back and giving him a hug. So you have to do it." And he finally agreed. He said, "We're going to put an asterisk by this, and if we see an uptick in cases, then will you agree to come back and revisit it?" And I said yes. And I'm thrilled to tell you we saw no uptick in cases when we got to go back in.
I don't
My
doubt
question
it.
to the
Yeah.
governor, it was very simple. I sat there in front of he and his wife, and I said to them, "Why am I allowed to touch my husband as a dishwasher, but I'm not allowed to touch him as his wife?"
Right?
I mean, it was pretty straightforward to me.
Yeah.
All I had to do was wear a mask as the dishwasher. That's it. No
Right.
gloves, no gown, nothing, just a mask.
Nothing.
And I continue to do that. I will continue to wear a mask. If that's what the staff is required to do, I'm more than happy to do that. And he said, "I don't know, but we're going to fix that." And he did.
And there's so many regulations like that. There's not enough regulations in other areas that need regulations, and then there's over regulation on things that don't even make sense, like what you just said, which is so
it just didn't make any sense.
It doesn't make
Right.
any sense. It's just counterintuitive, and hypocritical, right? I mean, when I would go to visit my mom, I could finally get in there as her essential care, as she was, getting worse, her health. And, there was times where they would have the yellow zone up because there would be an outbreak. But there was no difference between the
Right.
people going in there and out of there. It was just optics.
Some were,
You
some
know?
had big gowns, and and others just came in. There was no.
There was no, it was
consistency.
all just pumping. And like Don and I, we always laugh about it because, laugh not in a
Right.
good way. But, when we go to visit my mom during that time, it was like half the time there was a sign-in sheet where they'd take your temperature and you'd have to show your COVID test and everything. And the other times there was nobody there. We just walk
You
in.
could just walk in, yeah.
Well, what I've said all along is the truth of the matter is they didn't work. It didn't work.
It didn't work.
It didn't keep the COVID out of the facilities.
It didn't.
So we needed to, so not only did we lose people because of COVID in the facilities, but we lost people from failure to thrive, from people who
That's
gave
right.
up on the will to live,
And do you know if it was more? Do you know if those numbers are more on failure to thrive than they were for COVID?
Yes, that's a very good question, and that's not information that they'll easily release, right? They don't want to see, but that's literally what it says on the death certificates: is failure to thrive.
Oh, by the way, I have an issue with failure to thrive as a
as a
as a
go-to,
diagnosis for death. I mean, I don't. It's
Yeah.
and I've been posting
Right.
about that too because I heard that ad nauseum about my mom. She has failure to thrive, and she didn't have failure to thrive. It's a blanket,
Right.
kind of statement that
yeah.
they
It's a
is
coverall,
abused.
yeah. Yeah.
Yeah.
Right,
So,
right,
right. Failure to thrive, that means, you've tortured somebody by making them be in isolation like you would a prisoner
Correct.
and putting them in solitary
Correct.
confinement.
Well,
because
that's the thing, is the ultimate in punishment for a prisoner is putting you in is to isolate you.
Right.
That's the worst
That
you
is
can
the
do.
worst.
So what are we doing?
What are we
Right.
doing? I mean, what brilliant idea was that? But you know what it does, Mary, is it bleeds over into the bigger problem, which is quality of life instead, right? So there's some kind of misunderstanding or misinterpretation of what healthcare is, because healthcare is everything. It's wellness,
Absolutely.
inside and
Absolutely.
out, and you can't have one without the other. Babies don't survive without being touched.
Right.
You can't. That's why they have people that come in. They pay them to hold babies that are in the NICU, right? Because babies need to be held.
Right.
Animals
It is such
need
an
to be held.
instinctual. It's such a human instinctual thing. I was telling a story just yesterday about I was there washing dishes, and a friend, the woman lived there in the same facility as Steve. Her husband and I were in a support group together. So I knew them well. I knew Kathy well. And as I was leaving Steve's room one day, the other family members were not allowed in. And I saw Kathy going into another patient's room. And I was calling her out and said, come on, come walk with me, and I'm going to take you to your room. We look out for each other's family members when you're in there, right? I mean, and so she comes out, and she ended up dying. I actually looked it up yesterday. She died 6 months after my encounter with her. So she was in pretty bad shape. And she walked up to me, and I was walking her to her room, and she stopped and she looked at me and she said, will you give me a hug?
Yes.
And I almost didn't do it. I kind of looked around to kind of see, is there anybody here who's going to see me and I'm going to get in trouble for giving her a hug? And I did it. I just gave her the most amazing, wonderful hug. When I got in the car, I called her husband and I'm like, I just want you to know, I just gave your hug. That she articulated. A woman in final stages of Alzheimer's disease.
That's right.
Articulated, can you give me a hug?
Yes.
Tells you that
I'm
this
getting
is
chills.
Instinctual, right?
She needed that more than anything. She didn't ask for anything else. That's
can
the
I
thing
just
she
say,
needed the most.
Can I just, before we move on from that, is like how profound that is for everybody, that the bias against, first of all, ageism, and then the bias of Alzheimer's and dementia that is in our healthcare system built into it, that they're not there. They don't exist because they've lost skills, right?
So it doesn't matter.
So it doesn't matter. But the fact that my mom, after 3 months, when they said she had failure to thrive and were trying to just not take care of her, which is why I'm doing this documentary, Dawn was in the room, and I was always doing a dog and pony show. I could get her to laugh, we'd sing, but out of nowhere, and she hadn't spoke in 3 months, and she just said, I love you. Perfectly.
And
had
she
to
never
get
spoke, and she never said anything else after that either.
After that, just other than I got her to laugh, we got her to, she would go, and sing and kiss.
But she never said any other words before.
That
or
was
after.
it.
Yeah.
But I'm telling you, if that doesn't tell you that they're in there, and for that woman to say, will you give me a hug? And I told my mother this too. I said, what a feat you just did. I know how hard that was for you to get those words, find them, bring them on down, get those synapses going, and get it out. And she did that because she needed it so much. And my mom needed to tell me that. She wanted me to know that.
And you'll never forget it. I mean, it's just so powerful, right?
I was in tears. Dawn will tell you, I go, she just gave me the greatest gift ever.
Right.
That I know my mom. She was like,
Yeah.
God damn it, I got to tell her because I know her. And I said, Mom, you did that. You did it. I was so happy and so proud of her.
And if either of your mom or this other woman were completely isolated, never. I mean, they wouldn't have anyone to ask.
And it would have been dismissed because, she has Alzheimer's. She was at the end of her Alzheimer's.
Of course she's not.
Well, she's still alive, and guess what? She needed a hug.
Right. That's right. And I almost didn't do it. I
I'm
literally,
so glad you did.
right? I mean,
I'm
thinking,
so glad you
I might get in trouble. I might get in trouble. But I'm like, you know what? Screw this. I am
That's
giving
right.
her the best hug I have ever given anyone ever
That's
before.
like
And
running
I'll
around.
never forget it.
That's
right.
right. And
Yeah.
you will never forget it.
I will never
Never
forget it. I
forget
stood
it.
at her funeral. I told the story at her funeral because it's just something that it just tells you the instinctual nature of touching each other and holding on to each other.
That's right.
That we don't even have to realize what it means. It's just part of who we are, and it's
We're
just a basic human
We're
need.
social.
Right.
We
That's
are.
right.
That's what we are. We need connection. That's why people die. We need connection. And I told this story before, but there was a group of 90-year-old. They were the cool clique at the facility my mom was at. Right? They were all. They didn't have dementia. They were all cool as hell. Oh, and every time I would sing with my mom, when my mom could still sing, they come over. Up, Susie's singing. Come on, and like they were right, Dawn. They were all like the cool clique, and it's heartbreaking because every single one of them died during COVID, and not
Because
from COVID.
they were all separated. They were all separated.
That was
from
their
each other.
lifeline. Was each other.
Right.
And they were so vibrant and so
Vibrant.
And
We loved them. Yeah.
And just to know that they were all just then basically put in solitary confinement.
Right.
To what end? To what end?
I remember-
That's
what
what I
is
kept
life?
saying about Steve, that he has a terminal illness. I mean,
Yes.
he is going to die. What am I saving him from exactly?
Let's fill those. Yeah, it's not about the amount of
Exactly.
days. It's not the amount of days. It's what happens in those
It's
days.
happened.
Correct.
Yes, I'm
And
with
these
you
were
100%.
his best days. I mean, those days that I'm missing were his very best days. I mean, I always said he's going to decline tomorrow, and the next day, and the next day. He's
Yes,
going to be
yes,
worse.
yes,
It's
yes,
right
yes.
now. That's
You're
the most
giving me
important
chills
part.
all day long today. I mean, exactly. You're just hitting me right where it is. I mean,
Right?
you're articulating it beautifully. I mean, it's exactly that. Like, I feel so robbed from that
Right.
year and a half, whatever,
Right.
year and 2 months,
Year and
whatever
a
it
half,
was.
yeah, whatever it was.
And even though I got to see her once, that at 13 and a half months, then it was another month before they let us see her
Right.
again, because you had to
Right.
sign up, and it was like
Right.
they only had so much staff to like oversee us to make sure we weren't pulling our masks down, and so I didn't really get to see her until she got so ill and went into the hospital
She
from
was
the
so
wound.
advanced at that point. Yeah.
That was from the wound because she was being neglected. But that's the thing. I feel robbed because
Right.
I would tell everybody the same exact thing. I'm not delusional. I know my mom is going to die sooner than I want, and I know that. That's why I want to love on her
Right.
now.
That's the urgency of what we're
That
trying
is
to
the
do.
urgency. This is why her year of life is actually more valuable than someone who's 40 years old. Because they got a
Right.
lot of years ahead of them. She doesn't.
Right, exactly.
And it's meaningful to us. And it's meaningful to her. And if that's not important, then none of our lives are important then. Because we all are ending at some point.
That's exactly right.
Right? So I want to pivot.
We could talk about this all day long, couldn't we?
Oh, we could, yeah. But I want to pivot.
And you do.
because
You talk about it every day.
I do. I do.
Yeah, we do. I talk about it all day long too. I saw a post on Instagram that Mary wrote about, I don't know, 2 weeks after Steve passed away, and it was just really simply, now what? And it hit me so strongly because my mom had Alzheimer's for 16 years. And so my stepfather passed away 10 years ago, Dawn, I'm trying to remember. But so
Somewhere
for the
in there.
last
I
10
don't
years of
remember
her
either.
life, I was really her person. I was her person. And it's a long road. And I remember, and especially that concentrated of this past year was
Right.
so concentrated. And I thought, well, and not that it was my whole life. I mean, I have children, I have a career, But my mother
Right.
I felt like I was her mother, and it was so important for me to make sure that she was happy and healthy and in the best way that she could be. And then what? And then she's gone.
Right.
And there's so many mixed emotions with that. And what do you do? And how do you move on and keep your life as significant as it was? So throwing that to you.
I'm figuring that out. We're 3.5 weeks into this. I've been a caregiver for Steve and his parents for decades. Certainly for him, his father died 2 years ago. In a week or so, it'll be 2 years ago, and so I was his sole caregiver as well. I'm for the first time in decades, I'm not a caregiver anymore, and that's a weird thing for me to sort of accept or experience. I don't know how to not think about. I mean, for me, this time that we're talking right now is the hardest time for me, because this is when I spent time with him. I went with him in the evenings, and I mean, there was never a time I was at home at this time of day. I was always with him when the sun went down, and got him tucked into bed, and then I would come home. And so every day, many days, my car, even the GPS on my car actually says Rosecastle at Deerwood. I had to go in and I actually removed it because I didn't like it popping up every day when I backed out of the driveway, that it's telling me that that's where I normally go at this time of day. You know, it's 11 minutes away for me to get there. So it's a real sort of shifting in a mindset of consciously doing something else, of making myself get out, take a walk, get some fresh air, you know, meet friends, do things so I'm not just sitting here in the house. You know, I lost my parents, both my parents young. I was 17 when my father died. I was 29 when I lost my mother 30 years ago. And I learned a long time ago that, okay, this is going to sound really weird, but I actually appreciate and like grief, because I want to cry, and I want to miss them, and I want to feel it in my soul that this person who I gave so much to and who was such a huge part of my life is gone. I want to feel that, and so I want to cry, and so I do. So I'm taking it, you know, Wednesday of this past week was a really hard day for me. I spent most of it crying. I woke up Thursday feeling alive again. It was a beautiful winter day here, you know, I'm in Florida, so it's, you know, 70 degrees and not a cloud in the sky. And,
Burr.
you know, right. A perfect kind of winter day, and I mean, life's good, and I know that. I know my sister sent me a text, and she said, I'm sorry that you're so sad, but she wrote, but I know, because that's the way Mom raised us, that you're going to be okay. And I do know that. I do know the only way through this is smack dab down the middle, and the only way I get to the other side is if I experience it right in the middle. If I try to take detours and try to hide it and not let it be a part of my life right now, then that's not good for me. And I need to experience it. And so that's what I'm doing. The decision now is, you know, what am I going to do with my time, with my advocacy, right? I mean, somebody said to me, Mary, the nursing homes need such huge reform. You know, maybe that's the next thing. And I don't know yet. I do know this visitation we're not done there. Florida, I'm working on a constitutional amendment in Florida. The head of the Nursing Home Association here after we passed a law that went into effect, it's called the No Patient Left Alone bill, went into effect July 1st in Florida. No patient in a hospital or a nursing home or long-term care facility will ever be left alone again. After that was passed, the head of the Nursing Home Association told a reporter that I've become very close to that, well, as soon as we get another governor, if they don't like how this bill is working out for them, we'll just get a new law. We'll get rid of that bill and make it go away. If I do a constitutional amendment, it can't go away. And my Caregivers for Compromise group in Texas has done a constitutional amendment in Texas for their bill. And so we're going to work on that. We're going to get a constitutional amendment here in Florida so I can be sure with our large elderly population that stays in effect. And then I want to do this federal bill. I want it to be consistent. Part of the big problem is everybody in every state's doing it differently.
That's the problem.
You
Yeah.
have facilities across the street from each other that are allowing different things, and this has become it's been an interesting thing to watch. The power struggle, we've become adversaries with the nursing home associations, with the nursing homes themselves. Instead of being able to work together and do it together, we're doing it, we're against each other, and that doesn't make a whole lot of sense to me. So I do want to work on this particular bill, and then we'll see what happens. We'll see what comes up next.
It's so counterintuitive because you figured, okay, these reforms will benefit the nurses. You're going to have happier, healthier patients, easier to take care of. So for them to be pushing back on this makes no sense.
I think it's power.
It's power, and it's
They don't
really
want anybody telling them what to do and how they're going to run their business. They want to do it exactly, and money, right?
And
100%,
money. It's cha-ching.
100%.
It's cha-ching.
Right.
And
power and money is what drives all of this, isn't it? I mean, even our politics. So
That's right.
It is.
Well,
it is, and I'm not willing to accept that. Not when we can work together, we can do a better job of listening to each other and making it a better place and better arrangements for our loved ones that does benefit them. I don't care if they make money. I want them to make money.
I don't care if they make money either, but it has to be done, with conscience. It has to be done,
right.
I would like to see as much energy that goes into pro-life
Right.
for
Right.
pro-life.
Right.
Okay?
100%.
Right? I
100%.
mean, let's see that groundswell happen. And as much as it does the other way, there's so many politicians that are, hanging their hats on pro-life.
If you've never been in one of these places, if you've never seen what this looks like, if you've never experienced it from the inside, it's very hard to explain to people what it looks like and what's really going on in there. When there's not staff, I can't get anybody. One of the last days we were there, a gentleman fell, and I couldn't find anybody to help me get him up.
That's right.
And I took a picture of him and I sent it to the head of the Florida division. And you know what he did? He scolded me for taking this man's picture.
That's right. That's right.
Because
right.
that's what's important.
Because that's what's important. Yes.
As I said, I'm trying to tell you what's happening. Do you not want to know what's happening?
Because, Mary, they do know what's happening. They are very aware of what's happening. That's what the problem is. It's systemic, and it's very, very, it's been woven so tight that we need to break it. But it isn't going to be, we can do what you're doing is great, because you're dealing with what's happening like this immediate thing but we need 10,000 Marys to address the other 10,000 problems that are just as bad as the isolation problem.
100%.
You're just one person. That's why, so I'm being very on my soapbox today, but because it's true, we do, and I've never been political. I'm not like the girl that was, marching down, I went to the Me Too movement, but only because it was fun. My girlfriends were in the art, we went. It was fun. I made the hats for my friends, right? But this is, guys, this is so horrible. It's close, I'm going to get in trouble for saying this, but
not. Go ahead. I'm sorry.
It's genocide. What's going on? I'm just telling you. There's ageism, and people are suffering and dying needlessly, and nobody knows it because they don't know it. You don't know what you don't know. I didn't know it. I didn't even know what a bed sore looked like until my mom had a stage 4.
Right.
I didn't know.
What I've tried to say to all the caregivers for compromise is, what my mantra is now, and what I say my purpose is now, is to empower caregivers to boldly advocate for their loved ones so they look back with no regrets.
Right.
And it's exhausting. I mean, there were days at the very end when Steve he was getting aggressive with the staff, and so they just decided they weren't going to brush his teeth ever again.
That's right.
Punish him. They're going to punish him.
He doesn't want his teeth brushed. Are you kidding me? Are
Right.
you kidding me? Am I going to have to argue with you every single
Yeah.
day? Every
Yes.
day. We're going to have the
Yes.
same argument. Yes,
Yes.
I am.
Yes, you are.
I am.
And I did it
guess
too.
And then
what?
you
know what?
yeah.
I'm doing it. I'm going to do
Yeah.
it. I'm exhausted. I said that one of the last times I was arguing with them, I said, I started crying. I'm like, you think I enjoy this? You think this is what I want?
Yeah.
I want my life back. I want my husband back.
Yes.
I want to go and be with my husband and do the things that we used to do. I don't ever want to step in this place ever again. I hate this place.
Yes,
right?
totally.
You think this is what I enjoy? I have no choice. I have to fight for him, and I'm going. And listen, it's me, right? Think what they're doing for people who aren't like me, who are in there every single day. What are their teeth looking like? When was the last time they were bathed? All of these things were happening to Steve, and I was there every day.
I was there
You know?
every day for my mom, and every day, as you know, I don't
Was
want to
a
get people
different
sick
struggle.
about it, but
Yeah.
they put my mom on NPO for no reason other than they were understaffed, and
Right.
I had to come and pull chunks of dried mucus out of her mouth every day, and they only let me give her liquid on a sponge to suck.
They wouldn't do it.
They
Yeah.
wouldn't do it.
And then you become the enemy. I would walk in with Susie, and I wasn't the one complaining, and they looked, because I was with Susie, they looked at me like they wanted to kill me because she was advocating,
Well,
and
they
in a
wouldn't
very,
answer us.
very nice way. Honestly, Susie was, she was strong, but she wasn't, mean or vicious. But they wouldn't even. You'd say hello to them, they wouldn't even say hello back. They would just turn away from you, and
Yeah,
who
Well,
needs,
when you're nice,
you're
but
dealing
you
with
get a lot. You get gaslit.
You get nothing.
You
Yeah.
get gaslit. So I would say, "Hi, you guys. I know you're understaffed. Could it be possible that we could call the wound doctor, whatever?" And they're like, "Yeah, we'll look into that. We'll look into
And
that.
nothing.
Thanks
And
for letting us
nothing.
know." So that doesn't work.
No, what you're saying is so true. It was like that at the end. I could tell. And we were in, and listen, Steve was in a good facility, right? I mean, let me say,
5-star.
I mean,
5-star. Yeah.
Right. So,
Doesn't mean a thing.
It doesn't. I mean, I couldn't believe that they're giving me a hard time because I'm trying to do something that's in the best interest for him. I mean, we were on our 7th executive director. And in the 3.5 years that he had been there. And when I would say that, the new director would say, "You know what, I'm sick and tired of you throwing that in my face." So I'm not throwing it in your face. I'm simply telling you, we've had 7 of you, okay? I know how this works. So you act like that's not a fact. It's a fact. And you have to understand that your staff, number one, and your residents' families know that you may be gone next week. That's just a fact, and they act like that I'm the person. I'm the bad person because I'm not throwing that up in your face. I'm simply saying you're changing rules for no reason when they don't. I mean, it's just a mess. And that constant battle, I can tell you, I am truly happy to be over that internal physical battle that I have felt for the last couple of years, right?
Girl, let me tell you something. My mom, like you, I know you didn't want Steve to go. And I didn't want my mom to go. But the last week of her life, I was like, this was my worst nightmare, was to say goodbye to my mommy.
Right.
I was like, just die, please, because I cannot see you go through this anymore.
Right. That's exactly right.
Because I couldn't make any more changes. I couldn't help her anymore. And I sat there watching.
Which is so sad, isn't it?
So
it's
sad.
Just such a sad place to be as their caregiver, as their daughter, as their wife, to be in that point. Where I know, I mean, I've said to his kids, I mean, I have 3 step kids that are all grown. And, I've said to them, the truth of the matter is, as much as we miss him, we don't want him back like that. We don't want to be back. Well, we don't want to be back in that place. We don't want to have to be living like that again, So at least he's at peace.
Yeah. I remember going back to get her stuff, and I didn't look at anybody there. And I know that so many of the providers and the CNAs and the people that are in the trenches, their hands are tied. They're looking over their shoulders because it's all coming from the top.
Right. That's what when I can't find anybody, when I'm hollering for somebody to come help me, or we would be locked in his wing. I couldn't get out to go home until I found a staff member who could unlock the door and let me out. And so sometimes I'd be sitting there 15, 20 minutes. And, when you leave the room at 8 o'clock at night, I want to get the hell out of there. I want to go home. What I don't want to just have to sit there and watch all these other people kind of wandering around like zombies while the one staff member, it's not her fault. She's in the room with somebody changing them, getting ready for bed. It's not their fault. But here I am just sitting here for 15, 20 minutes waiting patiently for somebody to come out of a room so I can get the hell out of there and go home. I mean, so many nights you get in the car and just cry. I would just sit in the parking lot and just cry.
Me too.
This is just so awful.
And I'm guarantee you people listening have done the same thing. This is why I'm telling you folks, I have nothing to gain from this, personally from the documentary, but like your fight, what you're doing, we have to do this. We have to get this done in a big way because it is horrible. It's horrible the way it is right now. It's not sustainable. It's only going to get worse. CMS is going to make an announcement in February about staffing regulations. There's going to be new minimums, but the nursing home lobbyists are going to be fighting against that. And by the way, we've had regulations in California for, a while now, and there's no oversight. So guess what? It doesn't matter.
Correct.
It doesn't matter because I said to the director of our 5-star facility, I said, I know you guys are understaffed. No, we're not. Okay, but your CNAs are telling me that they're exhausted and asking me to help turn my mom. Well, they shouldn't be doing that. We're not understaffed. Okay, there's no pillows to even.
To it. Right.
That's right. There's they were stuffing dirty blankets to prop my mom up, and I'd go, I'll bring in pillows. I've got a lot of pillows at home. I came in with like bags and bags of pillows, and they like, what are you doing? We don't need those. And I go, but you do because they don't have them. Oh, well, that's ridiculous. We don't need them. It's
the last month of Steve's life, I actually hired my own CNA to be with him 8 hours a day, 7 days a week, to brush his teeth, to put him in clean clothes, to be sure. We doubled the amount of Depends that we were using. Okay, which will tell you how
what
often he
was going on. Yeah,
right. That he would get at least bathed down. A sponge bath every day, shaved. I mean, he had his facial hair. He has never, ever had facial hair, ever. And I've known him 30 years, and he had this long, stringy, because they just weren't doing it.
They weren't doing it.
And they said it was because he was being difficult, that he didn't want them to do it. Well, my own CNA did it. She was able to get him shaved.
Yeah.
So I knew, and I'll tell you, as expensive as it was, I'm so glad that I did it for that last
I'm glad
month,
you did it too.
That level that he was just being cared for at a completely different level.
I'm glad you are.
Unfortunately, most people can't do that. Yeah,
Correct.
Unfortunately, most people can't.
Most people can't.
They just can't. Yeah.
Yeah, I actually had someone in her 80s. Her husband died of Alzheimer's a couple of years ago, but they are very wealthy here in Los Angeles. They live in these high rises, and I interviewed her, and she said, I was so fortunate that my husband made enough money that I could get an apartment right across the hallway. I hired 3, nurses to be with him around the clock, and he lived his last, year, whatever it was, beautifully. And she could go back to her own apartment so that she could get her strength back again. It was like, but she said, I know that I am such a small percentage.
Yeah.
It's not reality. Yeah.
Right.
So this is not a way to look forward to getting older.
It scares me.
It should.
Right.
It should.
I mean, it is something that I'm just sort of coming to terms with. I just turned 60 in October, and it is something that I think about, that, I need long-term care insurance, but God, I don't
not
want
that
to go
good.
in long-term care. Right.
And it's not like it used to be.
And it's not like it used to be.
Yeah, my dad, when he first bought long-term care, it was for life. It was Then suddenly they said, "Oh no, we are now changing that. Now it's capped at 140,000." You know how fast that 140,000 goes.
Sure.
It sounds like a lot of money. It ain't, and they only divvy it out in small portions every month. He'd get like 2,900 a month, which helped. It was great to have, but it's not the answer. What do you feel are the chances for true reform? Up and down the line. You don't want to be fatalistic and say, "Oh well, there's no chance. It's too big." What can we do? You're doing it, but in a specific area, it's so big. What can we expect true reform?
I don't have much hope for that, to be honest with you. I really don't. I mean, and that said, I feel the same way about Alzheimer's research, which is a whole different topic. But I'm very pessimistic about it. I just think you've got too many people that are making too much money in both of those realms, by the way, that are not going to be willing to give that up to do what the right thing is. And that's what scares me about myself. I think about myself. What would I do if I got an Alzheimer's diagnosis? It would be... it is. And I don't know, I do think that there are people, I think that there are people with the best of intentions. And I think, we have in our group, we find a lot of people who loved one dies. And some of the group says, I can't believe we haven't heard from Alice. And, in a couple months, she's, now that her husband's died, she's kind of gone away. And I tell everybody, this is a personal choice. You have to choose how it has affected you. And you can decide whether or not this has such a profound effect on me that I'm going to continue to fight this battle or not. And there is no right or wrong there in what we decide to do. But there's people like you and me, Susie, who really feel like that and know that there are things that can be done to make it better. And one of them is certainly calling attention to it, which is exactly what we both have been trying to do in our own projects. But and I think that's certainly a start. And then you hope to, when people are profoundly touched in their own life, when we have the politicians that are going to be affected by this in their own life, it certainly helps to get them on board to do something otherwise.
Let me just add to that. I agree with you, and I want to say that the nature of being a politician is very much like the nature of being an actor. And I was married to one for 14 years, and as good as they are at their craft, they're not great as human beings. They're good at what they do. So that said, even if it happens in their family, it may not affect them that much either, is what I'm trying to say. So what will affect them is their ambition, and if that ambition looks like it might be on the line, that's going to affect how they make decisions. So if we can shame these people, and if we can make it look like we're going to take away their votes or their support and everything else, that's to me, is what I intend to do. This is the nature of ambitious people. So whatever it takes, guys, we have to do what we have to do. I may have to hire a bodyguard. I don't know. But,
But I think that you say you don't have, very much hope for reforming, the entire industry. But I think what we can take is from what you're doing, what Susie's doing, is to at least make it better. And hopefully if we keep making it a little bit better and a little bit better and a little bit better, then maybe that reform just is a long-term effect as opposed to, okay, now here's the new rules. I
agree with you.
And I think so we have to hopefully remain positive, and it's people like you, people like Susie who are helping do that. And so hopefully we can take that away from what's being done.
And let me tell you, in the work that I'm doing regarding visitation, we have to be present, not only to hold the hands and give the hugs, but they need to know that there are outside eyes that are on them who are watching what's happening inside of there. When you lose those eyes, when you lose the ability for anybody to hold them accountable for what they're doing, then we're in big trouble. So I think one of the dilemmas is even right. And so me fighting to get in, it is at the very least being sure that they're going to be outside eyes watching what they're doing, and they're going to be held accountable for the actions that they're taking with our loved ones.
Yeah.
yes. Okay, I don't want to get negative, but I mean, yes, we need to have eyes on them. But as it is right now, the way the industry is right now, having eyes on them and having that oversight doesn't really cause enough. It doesn't hurt them enough, even when it's reported, so it's really, right? So it becomes our responsibility to do damage control, which we're not in the position to do. And we need that oversight built in so that we can go to an ombudsman and go, here's what's going on. And that ombudsman actually has the power and isn't just a figurehead.
In Florida, they're useless. Absolutely
They're useless.
I don't talk to them. I've never talked to them. There's no reason for me to talk to them. There's absolutely nothing that
It's
they
a
can
waste
do.
of money.
In other states, it's completely different. There are some states that they are actually useful. I mean, I think Connecticut, I think New Jersey may have.
Connecticut,
people
yes,
that are
that's
sort of
because
vested.
Maria Painter's there. That's why she's one of the
Right,
best women in the
right.
whole world. And
Right,
she's going to be in our documentary, but she'll tell you straight away. It's like, it is not good. It is not good,
No,
and
I
she
agree.
is the real deal. She is
100%.
right.
She's worked a lot with our group, our Connecticut Caregivers for Compromise.
She is
They're
awesome.
very,
She's
very closely with
fierce.
her. So,
But we
yeah,
need
exactly.
fierce people. Let's go. Who else is
Right.
fierce out there? Help us. We're just two little girls here. Come on. And one guy. Come on. We need your help. We don't, it's not going to be radical. We have to really just be level-headed and know this has got to change.
Boldly advocate. That's what I say. It's boldly. It's not just, it's doing things that may be a little bit more out of your comfort zone, but it's boldly advocating, because not only will it, make a difference in these facilities and in the lives of so many people, it makes a difference in my life, right? When I stood at Steve's service a couple weeks ago and I said to them, I stand before you with no regrets. I stand before you being able to tell you that I did everything in my power to care for him. And that's an incredibly powerful gift that I have that I will keep forever.
I'm with you. Amen. I said the same thing. I said, the one thing I don't have is any personal regrets. I did everything that I could do for my mom. And, I was there with her to the very end. I got to snuggle with her after she passed. I mean, I did what I wanted to do as best as I could within their rules.
Exactly.
And
That's exactly right.
I don't have any regret. What I regret is the system that we've created that's so heinous, and that it took me this long to figure it out. That's the sad part, that and you and I and Dawn and your coalition are.
But I
we are
think
the
our goal
minority.
then is to be sure that when it's time for us to go, that we have no regrets, and also working to do what we can do to change that system.
Let's do it, everybody. Let's do it. Let's do it, do it, do it. All right. Well, thank you so much. This was a wonderful conversation. I know what now for you. Now
Yes.
what? I know what now. Now what?
Thank
we'll be
you.
on. Yes, I know that. You aren't going to stop. So
No, I've got some work to do. So
you got some work to do. Yeah.
I do.
Yeah, we'll have to hold each other accountable. Not that we need it, but everyone, it does get tiring, doesn't it? Sometimes it does.
It does. That's for sure.
Yeah.
But it's I don't know. It's kind of like I've worked my whole life to be right here at this time. I feel like that I was just the right person for the job, and still am. And so,
what better job, right? What better gift are you going to get from it? What I think about it all. I mean, I'm a filmmaker. I want to do my comedy films and my love stories. And yes, I want to do those. Those are great. But at the end of the day, what am I going to be most proud of?
Right.
Is something like this that really makes a difference. That's what else can we, that's the best gift we can give and get.
I agree.
All right. Thank you so much. Thank you so much.
pleasure.
And you know
Thank
what?
you very much for
It's so
having me.
great because it all started with love. With your husband.
It did.
It all started with me, with my mom. I love her so much. I will always love her so much. Why is it so profound, Don?
Well, because as we all know, and if we don't know it by now, we just don't know this, is that love is powerful, love is contagious, and love conquers alls. And we thank everyone for listening and watching today. If you like what you heard, like us, subscribe, share. Take care. Bye-bye.